Good afternoon, and thank you for joining us. Welcome to our third annual Go Far Louisiana Week. My name is Dr. Libby Saunier, and I'm the co-chair of Go Far Louisiana and the Chief Executive Officer of the Louisiana Policy Institute for Children. I'm honored to welcome all of you today to our keynote address. Go Far Louisiana is an initiative of the Louisiana Policy Institute for Children. It is a statewide movement dedicated to ensuring every child has access to high-quality early childhood education, health, and development services. Grounded in racial equity and community collaboration, Go Far Louisiana is committed to building a seamless, equitable system that supports families and prepares Louisiana's children for a bright future. At this time, it's my honor to introduce to you the Chief Executive Officer and co-founder for For Providers by Providers, as well as the CEO as well as the CEO of Wilcox Academy and Early Learning, and my Go Far Louisiana co-chair partner, Rochelle Wilcox.
Thank you, Libby. I'm Rochelle Wilcox, and I am absolutely thrilled to welcome you all to the third annual Go Far Week. This week is all about coming together as advocates, educators, parents, and community leaders to move Louisiana early childhood systems forward. We all know that when our children start strong, they go far, and that's why we're here. Over the next few days, we'll engage in meaningful conversations, hear community stories, and work towards solutions that will help shape our future, the future of Louisiana's children and families. And speaking of inspiring voices, it's my absolute honor to introduce today's keynote speaker, Dr. Cynthia Osborne, Executive Director of the Prenatal to 3 Policy Impact Center and Professor of Early Child Education and Policy at Peabody College at Vanderbilt University. Dr. Osborne previously spent 16 years on faculty at UT Austin's LBJ School, where she also founded Child and Family Research Partnership. A 2023 Aspen Institute Ascend Fellow, Osborne has led major state and national program evaluations and served as the National Academy's Committee to Reduce Child Poverty. Served on the National Academy's Committee to Reduce Child Poverty. She holds a PhD from Princeton, an MPP from Harvard, and an MA in education from Claremont Graduate University. Please help me welcome Dr. Cynthia Osborne.
Well, good afternoon, everyone, and thank you so much for the opportunity to participate in your Go Far Week. It's so exciting to see what you have all been doing over the last several years and to just generate this sort of enthusiasm and commitment to helping all children thrive. I'm so grateful to be able to be a small part of it. Again, I'm Cynthia Osborne, and really excited to share with you some information about policies that help all children thrive. And I have some slides that I'll go through and also have time to be able to engage in conversation and questions that you have. I hope you all can appreciate our little Sally Jesse Raphael baby here. So we're going to talk about what is it that states can do to really help to strengthen these earliest years? And our whole center is devoted to helping states, just like Louisiana, really meet the goals that you have for children and families in your states. And we're driven by what the evidence tells us are the most effective policies that will really ensure that everyone gets off to a healthy start. And then we work with you in ways that will help meet the needs that you have. And we are a nonpartisan research center, not here to tell you anything to do, but to help you meet the goals that you have. And the reason that we exist is because the science of the developing child is so strong about how important these earliest years are for development. The prenatal to age 3 of development is the most rapid and sensitive period of development that really sets the stage for all lifelong health and well-being. And we know that what it takes is for kids to live in safe and stable, nurturing environments with limited exposure to adversity, that really helps to build those neural connections that are forming more than 1 million per second in those earliest years, and really stimulate the part of the brain of your prefrontal cortex that allows you to um, develop those sorts of skills that we call life skills or essential skills, how to get along with each other, how to delay gratification, your critical thinking. All of that is happening in those first 3 years of life. And so we wanted to step in and say, well, what is it that states can do to really help children thrive during this period? Many of you may have seen this graphic before, and it motivated a lot of state leaders to say, oh, I see what's going on here. Across the bottom of the graphic is the number of months and age of a child. And up the axis is what we call this volume of your prefrontal cortex, the gray matter, the squishy stuff that really shows that your brain is developing in that region. And the more the volume, the more developed it is. And what this shows is that when children are exposed to these resource-rich environments, that their brain is actually developing more in that region than when they're not exposed to that environment. But it really also shows that when we're born, we're all kind of born with that same optimal potential, and our environments help to shape what happens to us. This doesn't mean that rich kids, that money is what matters. This isn't about that. This is about being able to create an environment with stable resources, parents that have lower levels of stress, that can actually do the caretaking that we know is so essential for healthy development. And so this slide really motivated a lot of elected officials and others to say, well, what is it that we can do to create these conditions in which children thrive? My team looked at all the evidence that was telling us how important those earliest years are, and we developed these 8 prenatal to 3 policy goals. Again, these are the conditions that if we could meet, all children would thrive. Making sure that families have access to the services that they're eligible for, that our parents have the ability to both work and care for their children, that our children live in households in which the resources are sufficient and stable, enough food, housing stability, economic security, that our babies are born healthy to healthy parents, and we think of both their mental as well as their physical health, that parents really have the knowledge and capacity, skills, time to engage in those nurturing interactions that are so important for that healthy brain development. And that when our babies are not with their parents, that they're also in these nurturing environments, whether it's in childcare or other environments. And that our little ones have access to the things that we know get them healthy from the beginning. So immunizations, breastfeeding, screenings. And that if we can identify any sort of developmental delay that they're going to have as early as possible to get them and get them the treatment that they need to get them back on track for optimal development. So this is what we know families need. And so we turned to the evidence and said, well, what are the policies that states can implement that will help to create those conditions? We're not at all neutral to those goals. We share those goals with you and with every state, but we were neutral to what the policies were. And so we reviewed dozens and dozens of state level policies and thousands of documents and really honed in on those studies that show a causal link between implementing the program and better outcomes for infants and toddlers and their parents in at least one of those policy goals. And what we found is that there are things that work. We have some answers. We don't have all the answers. We're going to continue to learn forever. But there are things that states can do that will help children to thrive. And if we can get that information into the hands of decision makers, excuse me, I have a slight cold, that's going to give them the policy choices that they need to really make a difference. Pardon me. I was hoping this cold would set in for a minute. We also know that there is not one policy or program out there that will just target the child. Pardon me. Infants and toddlers do not live in isolation. They really live within their family, within their community. So all of the policies that are going to help them are going to also be helping the parents. And our policies have to think about helping the caregivers so that they can do the job of helping their children. And this can be child care workers, it can be child welfare workers, or behavioral health specialists, or parents and other family members. We also know there's no magic bullet. There's no one policy or program that's going to do it all. In order to help children to thrive from these earliest years, it requires a combination of broad-based economic and family supports, as well as targeted interventions to really meet the needs that families have. And finally, in addition to identifying what policies work in terms of which are effective at helping states, we also monitored what every state is doing toward implementing these effective policies. And the variation across this country is vast in terms of the resources and benefits that families have available to them. And that makes a big difference in terms of, where kids are born has such an indication of what they're going to have access to. So we identified now 17 policies and strategies that, have an impact on at least one of those 8 policy goals. And we think of these as a system. Pardon me. I was so hoping this wasn't going to happen during this address. We think of this as a system of support. In which the family is centered in the middle, and the institutions that are there to serve the family really surround them. That the policies and programs are really aimed at meeting the needs of the families. Whether these are health policies or economic policies or learning policies, the truth is there's a lot of overlap across all of them. And we put these policies that you just saw in that circle on what we call our grid. This is really our roadmap that shows you how those policies and strategies are aligned with those 8 policy goals. And what we see is that there is no one policy that's going to do it all, and that you can choose where you want to start as a state, of whether it is that you're starting with a particular goal or starting with a policy, and you can really build the evidence and information that you need from there. We invite you to go online and to visit your state's roadmap and to dig in more into all of that we have there. But we provide this both at the U.S. as a whole and for each state. And like I said, you can either start with your goal of what it is that will help to produce better birth outcomes, and you can see the policies and strategies aligned with that. Or you can start with a potential policy goal that you might have that you want to work toward, and the roadmap will help give you information for that. Well, what I want to do today is to really talk about how states vary in implementing these evidence-based policies. And I'm going to go over several, but we have more information on all of them if you're interested in the Q&A, and definitely highlight where Louisiana stands on these policies and strategies. So I'm going to tell you how we get to these numbers and these very colorful bars, but basically this shows the level of resources that a mom with an infant and toddler who is working full time, the minimum level of resources she has available to her in her state. And in a state like Colorado, she has more than $56,000 in resources to care for her 2 children. Whereas in North Carolina, she has less than $21,000 in resources. And Louisiana is somewhere in between with $28,000. And I'm going to show you kind of how we got there thinking of these different policies. We start with earnings and what the minimum wage earnings are for workers in your state. We think about paid family medical leave, of whether the mom has time off from work after having a baby to care for her child. We think of out-of-pocket childcare expenses because in order to work, she has to leave her children someplace that is safe. That's going to stimulate their brain and body development and lead to better outcomes for them. We think about nutrition benefits as well as federal and state taxes and tax credits. I'm going to show you kind of how that all aligns. So let's start with earnings. And the research is pretty clear that higher earnings lead to better outcomes for families. That in fact, states that have implemented at least a $10 an hour minimum wage see improvements in both reducing poverty and improvements in birth weight and birth outcomes, as well as reducing child maltreatment and better health outcomes for children overall. And right now, there are 30 states that have a minimum wage that's at least $10 an hour. And the minimum wage, last year increased from 25% and 25 cents an hour in Montana to over $2 an hour in Ohio and Michigan. And we know that at least 23 states have implemented a wage increase just as January 1st. And these wage increases, although they may seem relatively modest, actually add up to quite a bit. Just 25 cents an hour leads to additional $500 in annual earnings. And that's enough to cover about 4 weeks worth of groceries for this parent of 2 young children. So any little bit actually goes quite a long way. But as I said, there are 30 states that have a minimum wage that's at least $10 an hour. And most of the other states that don't are at the federal minimum of $7.25 an hour. And that was established in 2009. Surprisingly, more than a third of states by next year will have a minimum wage that's at least $15 an hour. So we're going to see a third of states that will have basically more than twice the minimum that another third of states has. With paid family and medical leave, this is a program that provides support for families after they've had a child, either by birth or foster placement or adoption. It also provides support when you yourself are sick or a loved one needs to be cared for with a serious illness. And paid family and medical leave programs have one of the strongest bases of evidence that they really make a difference in families' lives. So they allow more people to be able to take leave. They're one of the most pro-work policies that we have, meaning that mothers are much more likely to return to work and work for longer. They reduce poverty and food insecurity. They reduce infant mortality. They increase time with children. There's just a range of positive outcomes associated with paid family medical leave programs. And as of January 1st, there are now 12 states that have implemented a paid family medical leave program. Maine is going to do so later on this year, and Maryland plans to in 2028. And there may be some other states that implement it, before that time even. But states vary quite considerably in what their paid leave programs look like in terms of the number of weeks that a family can take. So in Rhode Island, California, it's 8 weeks. In the other states, it's 12 weeks. And the percentage of the wages that are actually replaced by the program, the maximum amount that families can get, and who pays for it. Paid family and medical leave programs are actually paid for through a payroll contribution. Sometimes it's just the workers, sometimes it's both employers and the workers, and other times in DC is just the employer. It's a fraction of your wages that are paid in to a group pool, like unemployment insurance or Social Security, that you can then draw on when you have a child or a medical condition. This variation in the duration and generosity of those benefits really leads to a lot of variation across the states in terms of how much families get from their paid family medical leave programs. In Rhode Island, these numbers haven't been updated as of January 1st, but they get just over $5,000, whereas in several states, they get over $12,000 for the worker with the same wages. So varies based on what states are doing. There's been a huge push, including in Louisiana, to offer paid leave for state employees. And that's a really good start. It's the more expensive way to do it because the state is paying the whole bill instead of sharing that with the workers. But it is helpful for those individuals who can get it. So childcare, again, is so essential to allow families to work. And that we know that it is one of the most pro-work policies that we have, and it increases financial security within the household. How states implement their policies, though, for childcare ranges so much across the country. And there are these three key levers that the federal government provided guidance on are targets for states. They've changed their guidance, but they remain, I think, important targets of how you set your income eligibility, of what the co-payments are for families, and what your reimbursement rates are. Now, doing one of these without the other, you kind of end up with a whack-a-mole problem. If you make more families eligible with the same amount of dollars in the system, then each subsidy has to be worth less. If you want to make a lot of families eligible, you may need more families to pay in co-pays and so forth. So without significant additional dollars into the system, sometimes these levers are kind of a push and pull on one another. But let's look at how they vary across the country. So just for income eligibility, there's huge variation. In Vermont, families that make over $125,000 are eligible for a child care subsidy, whereas in Georgia, you have to make less than $27,000 in order to be eligible for a child care subsidy. And you can see Louisiana is at that 85th percentile of their state's median income, which is what the federal government allows you to use their dollars on. And so that's around $68,000 a year that you may be eligible for a subsidy. And this is just the variation across the country in what that looks like. This is in terms of states' median income, and New Mexico has the highest, and Georgia has the lowest, and states are everywhere in between on who's eligible. In terms of how much families have to pay, meaning that, so you have a subsidy, but you still have to pay a portion of that. The target is that families shouldn't pay more than 7% of their income on childcare. And Louisiana actually meets that target in such that families are not paying more than 7%. But you can see in some states that they're paying quite a lot. Ohio, it could be over 25% for some families. So states have a lot of latitude in setting those co-payment rates. The other thing that they have complete latitude in is setting their reimbursement rates, so that if you get a subsidized slot, how much will the state pay to the provider? How much will you be required to pay? And this is based on a state's market rate, which is basically how much are providers able to charge families, how much are families able to afford, not necessarily on what it costs to provide care for children. But every state varies quite a lot, just in terms of what we call their 75th percentile or equal access target, which means that that reimbursement rate would cover 75% of all the childcare slots that are out there. And states vary in terms of what that dollar amount is. So in Texas, it's $1,400 a month. In Louisiana, it's $1,400 a month. In Texas, it's just under $1,000. But they also vary then in how much they're going to pay the provider, how much the family has to pay the provider, and whether, like in North Carolina, that target, the reimbursement rate is well below that target. And so the family would have to pay even more to get access to that higher quality care. So there's huge variation in all of that. States are still working to advance policy in childcare. New Mexico just announced that it is going to be providing universal childcare. There are states that are creating these dedicated funding streams like Louisiana has, and really trying to put more money into the system in order to allow more families to be able to access the subsidy, because without it, it's so hard to afford. They're also doing a lot to try to encourage employers to be part of the system and offer childcare and a host of other sorts of policies. I'm going to focus just for a second on SNAP, which is the most robust nutrition policy that we have across the country. And states largely have had little say in how SNAP, what the role in SNAP. What they've been able to do is really think about the administration of SNAP. It's been a federal program. The states administer it and give it out to folks. And so the state could make different decisions about how long that recertification period is, what families have to report, whether they can go online and do most of these things. And by being able to make the certification longer and more access to online services, this makes it easier for families to be able to get the benefits that they're eligible for and keep them. But across the country, there are a lot of families who are eligible for SNAP who are not actually getting it. In Louisiana, you're doing better than a lot. But still, 1 out of 10 families that are eligible for SNAP are not currently receiving the benefit. And so the things that you can do to help families get on it are also things that you can do to reduce your error rate. And this is becoming more and more important. This past summer, the federal Congress passed H.R. 1, and that changed the way that SNAP is administered and paid for. Now, where states and the federal government used to split the administration costs 50-50, now the states have to pick up 75% of those costs. And in Louisiana, that's an additional $42 million annually that the state is going to have to pay if nothing else changes. The following year, the states are going to have to pay a portion of the actual benefits themselves. And that's based on the state's error rate. And errors are caused I'm sorry that I had a slide there to show you the error rates across the country. But error rates are really caused by state workers either overpaying or underpaying. It's not about fraud, waste, or abuse, but the way that you reduce your error rate are also the same ways that you reduce your administrative burden. So hopefully states will pay attention, because if Louisiana has to pay based on its current error rates, that's another $95 million a year that it's going to have to pay in SNAP benefits. Finally, let's talk about tax credits. State tax credits are one of the most effective policies we have to both promote work and financial security for families. The one that's been studied the most is the state earned income tax credit. It piggybacks on the federal tax credit, and usually it's offered as a percentage of that federal credit. There are now 24 states that offer a refundable earned income tax credit that's at least 10% of the federal credit. Pennsylvania just enacted this this past fall, November. And there are other states that have non-refundable credits or credits that are below the 10% threshold. And Louisiana is in that group. So you have a 5% refundable credit. And although that is helpful for those families, the research tells us it takes at least double that to really start to see the impacts that the literature tells us is possible. And in addition to earned income tax credits, states are now implementing child tax credits. There have been 16 states that have implemented a child tax credit so far, and those vary quite considerably in terms of the range of the credit. In Colorado, you have, $4,000 a kid, whereas in Illinois, it's just about $275 a kid. And those are the refundable credits. And then you have some non-refundable. So states are doing everything across the board. And the research hasn't yet caught up to tell us what's necessary in order to really see these impacts. All right, in my last 5 minutes here, I want to show you how all of those policies that I just talked about start to intersect and lead to that level of resources that I started with. And I kind of primed you to say, how does Louisiana get to $25,000 a year? Well, we've created a tool called the Policy Impact Calculator that you can use to really start to explore policy changes in your state and how all these policies intersect. So I want to introduce you to Lena. She's a stylized mom of both an infant and a toddler, and she works full-time all year round at a minimum wage job. Now, she did take time off to have her infant, and she took 12 weeks of leave that she's eligible for under the Family Medical Leave Act. In states in which she has paid leave, then she would be eligible for that. In order to work, she has to leave her children in childcare, and she leaves them in care that is at that 75th percentile mark. That's what they charge. And we also assume that she applies for and receives everything that she's eligible for and pays her taxes and gets all of her tax credits. So let's walk through what it looks like when we combine her earnings, her paid leave, her out-of-pocket childcare expenses, her nutrition benefits, and taxes and tax credits, and how it leads to this huge variation across states. So first, let's just walk through Louisiana. Again, you guys are right around $28,000 a year in total resources for Lena and her family, and you rank 35th. So with the minimum wage, that's $7.25 an hour, and that leads to just over $15,000 a year in earnings for Lena. But she did just have a child, and she needed to take those 12 weeks off. And so that leads her to forego around $3,500 in earnings. And if you had a minimum, paid family medical leave program, then some of that would be protected. But because you don't, now her earnings are down at just $11,600. But she has to pay for childcare in order to work. And the cost of childcare in Louisiana for her 2 kids is over $19,000 a year. So in order for Lena to work, if she does not have a subsidy, she has to use all of her earnings, plus somehow beg, borrow, and steal another $8,000 just to go to work. There's no way that Lena is going to do that. There's no way any of us would do that. But in Louisiana, she does get a subsidy, and that helps to protect those earnings. And it makes it possible for her to keep working and to leave her children someplace that is safe and high quality. We also then add in the nutrition benefits in both federal SNAP and WIC, as well as the federal earned income tax credit in the darker purple and the federal child tax credit in the lighter purple, as well as the income taxes that she has to pay. And that adds a significant amount of money to her resources. And then because you have that earned income tax credit that's refundable, that adds a few more $100 to her resources, which leads her to having over $28,000 for the year. Well, $725, often people are like, that's not what people earn. That's too low. I'll show you in a minute what if she earned $10 or $15 or $20. We also, though, really care about those families that are well above the poverty level. They're not necessarily at risk of falling into poverty, but they're still struggling a bit to try to make it. So what if her income was at 300% of the poverty level? So at that point, rather than $28,000, she's making just under $37,000. And let's see how she gets there. At 300% of the federal poverty level, that's around $38 an hour. She's making just around $80,000 a year in earnings. In order to care for her child, she takes those 12 weeks off, and that loses a substantial amount, around $18,000 of those earnings. So now she's closer to $61,000. She has to use childcare, and again, that is around $19,000 a year to pay for childcare. And in this case, she's not going to be eligible for a subsidy. So all of that has to come out of pocket. So now we're down to just over $42,000, from the $80,000 down to $42,000. Now she pays her taxes and whatever benefits she'd be eligible for from the federal government, which is none. So after paying her income taxes, she's down to just around $38,000. And then paying some state taxes, now she's just under $37,000 a year. And this is a really, big discrepancy. Here, making $7.25 an hour versus $38 an hour. But the difference in the level of resources at the end of the day that she has to care for herself is just about $8,000 more in that, despite the fact that there's more than $30 an hour more in earnings. You can also look at how Louisiana has changed over time. What has been the impact of some of the policy changes that you've made? And you can see that by reducing the out-of-pocket child care expenses, that from 2020 on, that you've really been helping to protect those earnings. That 2021 accounted for the large federal child tax credit that went away in 2022, but you've been largely stable since then. You can also look to see how does Louisiana compare to your surrounding states. Is it better for Lena to live in Louisiana or to live in Arkansas, for instance? And in Arkansas, she's going to have higher wages. Her minimum wage, it's $11 there, which allows her access to more of the federal earned income tax credit and child tax credit. And so, but she's not better off if she lives in Texas, slightly better off if she lives in Florida. And you could do this for any state in our interactive calculator. We also can show, well, if we're going to get started and we're going to do something to help provide Lena with more resources, what would that be? And you can, the bars, the top bar is the baseline. That's kind of where you are now. And each of the subsequent ones is one change at a time. What if we increased wages? What if we enhanced our earned income tax credit? What if we did a paid family medical leave program or a child tax credit? And you can start to see which ones have the biggest influence on Lena. And we could work with you to see, is that helping the majority of families, a small number of families? How much does it cost? And so forth. And then we also look at different wages, because this starts to get into these benefit cliffs that we know are so important for families to consider. And what we look at are the kind of current policy, which is your minimum wage at $7.25. We look at the 10th percentile wage, which is around $10 an hour, what $15 an hour looks like, what your average weekly wage, which is around $28 an hour, what $30 an hour looks like, and what this 300% looks like. And what you see is that, when you start moving from $15 to $20 an hour, despite the fact that you are going up, in this case, this is a $13 an hour increase, which is around $26,000 in earnings, you're only getting around $5,000 more in resources. When you move to $30 an hour, you're actually starting to go backwards by some of the benefits that you're losing. And by the time that you're at 38, you're really kind of moving backwards. So we have to always think about the families who are at the bottom, and we have to think about those families who are working just as hard and struggling to kind of get out of the grind, if you will. So I invite you to check out our calendar and to also think about the resources I was just talking about in the context of all the other policies that are available to Lena. And in your state, you have early intervention services and group prenatal care, Medicaid, and so forth. But to think about it more broadly and the system of support that you're actually providing for her. So I invite you to check out our roadmap, to look at our policy impact calculator. And I'm going to stop there and make sure that there's time for questions.
Thanks so much, Cynthia. I've heard you several times, and each time I get a new gleaning with the information you share. And Rochelle's right next to me. And as we were listening to you about just the families' incomes, it's so hard for them to get ahead.
So hard to get ahead.
And
You
they're
think that you've made it, and then it's like, oh, but
I didn't.
now, yeah, so hard to
It's
get
so
ahead.
hard. Now we're gonna move to question and answers. So please post your questions in the comments section of the platform you're viewing, whether it's Facebook, YouTube, or Instagram. So we would love to get some questions. I am gonna kick us off with a few from your perspective, based on data and research, because I know that's where you live, as we do. What state policies have the strongest evidence of improving infant toddlers and for infant toddlers and their families?
I think all of the policies on the roadmap have an impact. I think it's about how you want to target it. Is it to the infants themselves? I would say a paid family medical leave program, doulas, having access to community-based doulas. Those are programs that really do help a broad swath of families in a targeted time period to help with that transition to parenthood. There are other policies, though, like child tax credits, earned income tax credits, that provide resources to households in important ways that help to reduce the stressors. And they go pretty broad to the number of families that are impacted by them. But again, no one can work. You have to be working to take paid leave. Well, you can't work if you can't afford childcare. So it becomes this kind of cycle of the need for creating this system of support. But I would say that those are the ones that are more broad in scope, that are really essential to helping families be self-sustaining and helping kids thrive as early as possible.
I want to really hone in on that. There's no one panacea.
Nope.
It's really about the systems approach to how do we improve outcomes for children and their families. And we do a ton of work in the early education space. And that's what the joy of the work related to Go Far is, to think about the systems that support young children and their families, because there's no one silver bullet that's going to fix it all for us.
That's right. And I think the more that we can start to identify what the family's actual needs are, rather than just giving them what we have. So these screening programs that can really start to, get in understanding, oh, this is a family that really, it doesn't need a 20-week program of this. It needs food or it needs connections to other sorts of services. I think that that's really essential and can be more efficient when you have more limited resources.
I just saw a thing in the chat about doulas. Absolutely, doulas is one of those things that really supports a family. We have a steering committee for Go Far, and one of the moms today was sharing in Alexandria, because of the work we've collectively done as a coalition, she's going to be able to take part in having a midwife this pregnancy.
Oh, wow.
So Go Doulas, Go Midwives, those were not places that we had especially for our rural communities in the state.
They can make such a difference in those communities. We know communities are struggling to keep birthing centers open. And, there's, again, even no magic bullet just in the perinatal health sphere. Doulas are not the only answer. Midwives are not the only answer, but they are part of a really important system of support we're trying to create there.
They're saving lives for sure.
Yep.
From your perspective, what are some of the biggest barriers that states face when trying to implement effective early childhood policies?
Yeah. I think the adoption piece is thinking about the cost, right? And so we work with states all the time to be able to try to show the return on the investment that these will have, both immediately as well as over the long haul, because elected officials have a responsibility to use scarce public dollars as wisely as possible and as efficiently. And so we try to bring that information to them about what will actually, matter over the long haul. Implementation becomes a challenge because then you're really thinking more of a community level. You're building trust. You're thinking about how you're getting folks to be informed about a policy, trust that they can actually use the policy, and then that it's going to benefit them. And so, you have the what I love about what you guys do in Louisiana is that you are also so local as well as this statewide coalition, because it's that local community that really is going to make implementation even of a tax credit, which is seemingly something done at the state level. It's going to be why people go and fill out their taxes, because someone that they know told them this is real, and you go and do that, and you can take time off of work if you're a state employee, that sort of thing.
Yeah, tax credits don't sound very good until you have the benefit of being able to apply for them and really help to support your family. So.
Absolutely, families rely on this. It's kind of one-time money. This is the time of year that people start to say, I'm going to get my taxes. For me, it's when I delay until April because I have to end up paying my taxes. But others really rely on this for moving apartments, putting new tires on their vehicle so they can get to work, buying a computer for their kid to be able to use in school. These are really important investments that families are making.
Yeah, Louisiana is the first state in the country to have this school readiness tax credits that we've since renamed the Louisiana Workforce Child Care Tax Credits. But I can remember being in the post office a couple of years ago with one of our early educators. I just happened to be there, and she was filing to get her tax credits back for being a credentialed early educator. And she told that post office person, this is very important. And I had like tears in my eyes because she knew like the value of what she was getting. And I'm sure she knew exactly how she was going to spend all that money.
Yeah.
And it's not all that money, but it's something meaningful. And so for our parents and our early educators, that's increasingly important, especially as we considered, just where we are financially in the country with, all the things. So
yeah, no, these are, families are making tough choices of how to use these scarce resources, and any kind of blip, when we study poverty, we talk about this kind of flat tire leading to homelessness, right? It's almost like the butterfly effect, but for how one ends up just in a low position that you never thought you were going to be in. But if you get a flat tire that you can't afford to fix, and you can't get to work, and you lose your job, and you lose your childcare, and it's cascading effects. And so these are the sorts of policies that make a big difference for families.
They do. And I just want to say before we kind of wrap up too, if we think about the work that you do, Dr. Osborne at Vanderbilt, with the calculator and simulating things, and then we look at our friends in the United Way space with Alice with asset limited income constrained yet employed, when you put all of this together, you really do get a fuller picture of our families in our state. And we know in Louisiana that if you put poverty together with Alice, that's over half of our population. And so that means neighbors on both sides of us are struggling. And so our hope with Go Far Louisiana, and we're already seeing some shifts, which is exciting, is that our families actually feel that things are changing for the better for them. So we really can't thank you enough for being here today, for your insights, your powerful presentation on the critical importance of prenatal literacy, as well as shaping, how it shapes health, learning, and behavior over a child's life. And I believe you'll share your presentation with us. Right. So whoever registered, we can help get that presentation out for people to see. Thank you so much for today. We appreciate
Well, thank you for having me. And again, my apologies for my cold.
It happens.
We talk like this. But thank you so much, Libby, and best of luck for all that you guys are going to do this week.
Thank you. And thank you to everyone who took time out of their busy schedules to join us for today's program and subsequent discussion. Before we close, I want to recognize a tremendous leader and my friend for her outstanding leadership as co-chair. Your commitment, your voice, and the way you consistently show up for families and providers across Louisiana will never go unnoticed. Now, I'd like to ask Rochelle to offer some closing thoughts.
Thank you so much, Libby, and the same to you. We are so grateful for Dr. Libby Saunier and for Dr. Osborne for sharing all of that information. I love the way she was able to tell it in stories that made it real for us. Specifically, having all of the data for Louisiana, that just was so impactful. So I just want to say thank you again. And we're looking forward to a full week of programming in recognition of Go For Week. Throughout the week, we are hosting regional events for advocates to learn more about what it means to be a champion for children. For details on how to tune in to the week's programming and learn more, please follow us on social media at Go4LA or visit the website at go4la.org. We are just happy to have you. Thank you.